everybody, it's Dr. Sandy here, and I am so excited to be here today because I cannot wait to talk to you about this Together Wellness. It is the most extraordinary company, and I am so thrilled to death to be able to share this with you today. We are a marketing, consulting, and education company that has embarked on a new mission, and that is to bring telehealth and telepsych to nurses, nurse practitioners, and doctors. And I am so excited to be able to share this with you today. And so please bear with me. You might want to take some notes. It's going to be super exciting and a lot of information. So I'm going to go ahead and I'm going to jump right in, and I'm going to go ahead and start my screen. Let's get this thing moving. So let's see here. So here we go. So Together Wellness, it is a company that is going on the tenets of Nurses Against Violence Unite. So if you are part of Nurses Against Violence Unite, you will see the culture that we have created, and that is to bring awareness, to educate, empower, and eliminate violence in healthcare. And then, so now what we're doing with Together Wellness is to change the face and revolutionize healthcare. And it's so exciting because we are going to help and assist our family, our healthcare family, and in nursing to be able to have free to sliding scale health, medical, and psych and addiction services for not only just the first responders, but frontline and all healthcare workers and those that help us with their jobs. It is so awesome. And then to offer an enhanced reporting system to help keep all of the other people held accountable for their actions. So at a glance, a little bit about our company. So there I am over there on the left. I'm the co-owner, and then Dr. Whelan is, Dr. Jessica is the other co-owner. And she has a lengthy career working as a registered nurse and has been a nurse practitioner for 7 years. She is a keynote speaker for many pharmaceutical companies. She's extremely intelligent, and she's one of my closest friends, and I absolutely adore her. Miss Diane Boswell has been doing billing and coding for over 30 years and has a lengthy background with working with various amounts, like 52 doctors at one time that she managed to practice. She is very knowledgeable and is able to negotiate high rates and reimbursements for your claims. And that is extremely vital, especially in this day and age. So, and also a little bit about myself. I've been in healthcare, I've been in nursing for 29 years, and I started out as a nurse's aide assistant and climbed the ranks. Throughout nursing school. I was an ER technician, and then an LPN for 4 years, and I've been an RN since 2010. And I am also, I just received my doctorate last year, and I'm getting ready to finish my psychiatric nurse practitioner. I'm super excited about that, and with this new adventure that I'm going to have as well as also being your mentor and to help you get through building your brand and finding out a little bit more about what we're doing here. So specialties, we're looking for doctors, nurse practitioners, registered nurses, licensed practical nurses, as well as also mental health therapists that are specialized in addiction, child, adolescent, and adult, as well as life and wellness coaches. They're very important as well because, to help with diet changes and to help with more of a holistic, touch to our company. So, as well as also, so nurses, their role is more of an illness prevention nurse, to be a case manager, to make sure and follow up with the patients and make sure that they're getting the care that they deserve. This is extremely important because there are a lot of patients out there that feel like, sometimes patients can't get appointments for like 2 to 3 weeks. Sometimes it's months. So we want to make sure that we try to get them in to see a provider as fast as we possibly can, and to also give them the support that they need. So nurse practitioners. So nurse practitioners, we're looking for psychiatric nurse practitioners, family nurse practitioners, as well as also pediatric, adult care, and acute care and adult gerontology. As well as, again, we're looking for the therapy the more holistic addiction, child, adolescent, and adult, as well as life and wellness coaches, as well as also other business partners. Pretty awesome. So where can you do your business? You could do your business anywhere that you want, as long as it's in a HIPAA compliant area, that you're not exposing patient information to people that, you know, the people that like to look at information. So you could do this business out of your home office, your office, is also also on the go. So if you need to do a couple follow-up appointments and you're en route to go on vacation, you can do that. This is a cloud-based company, as well as you're able to do it with your phone, your computer, or even a tablet. So it's completely mobile. So it's a basic business concept, and we're going to talk a little bit about who does it affect. So telehealth and medical, psych, and addiction is extremely popular, and we are on a wave of innovation. There's 3 areas in particular that I am looking to want to evolve with, and that is Nurses Against Violence Unite, to work on a program to help healthcare workers to receive the care that they need, as well as also insurance companies. We're working through various insurance companies to make sure that we get the best rates, and also, and they would also give us patients to also work with. Also building your own brand. This is extremely important for especially those really autonomous nurses and doctors that really want to have their own model, and that they love what they're already doing. We would just come in and help them manage their back end, which would be the business in a box. For everybody else, the sky's the limit as long as it's within your practice. Show me the money. So it's no cost to join, nothing at all. So if you decide that you would like to work with us, this is how it works. So Nurses Against Violence Unite. So we're aiming to assist healthcare workers with both medical and mental wellness, as well as insurance companies. We credential you and to several insurance companies, as well as negotiate on a yearly basis the highest amount of reimbursement. And also building your own brand where you'll get paid for your patients and customers, minus the extra expenses that you independently incur. So this is how much money you're going to be making. So out of every claim, you're going to be making 60%, and 40% would come to take care of your business in a box. So you would earn from the patients that you see, whether it be from any kind of category, a business that you create. And then the 40% are business expenses that are paid for you, minus extra costs that you incur on your own. So what do we cover? We cover credentialing, which is in your 40%, billing, coding, the revenue cycle. We also have the EMR system that is seamless and it integrates perfectly with the bigger named companies. And also appointment reminders. So that would start like on 3 days prior to their appointment, to make sure that the patient is well understanding that their appointment is coming, so that they don't miss. And also awesome customer support with the EMR system. And then assistance, guidance, and support with Dr. Jessica, myself, and Diane to help you with your business. So we also want to offer a quality outcomes bonus, which is very important, especially with the hard work that we're doing to make sure that we're giving tailored and specialized care to these patients. It's important, and it's a lot of pride when you can actually help somebody from being on, we'll say, like 10 medications to help with their comorbidities and maybe their obesity, and get them down and off of some of their medications. Not making any medical claims, but it's pretty rewarding, especially if you're fully aware as a healthcare provider that how these changes with even diet can help a patient. So, and these are so many other things that we're going to be working on, and we want to give back 1% of the end of the year overall total revenue back to our healthcare providers and those assisting us with the nursing part. Disclaimer: it is subject to term changes, like say, for instance, we're going to work on obesity one time, or and then now it's changing into, okay, so now we need to decrease smoking more. It just depending on what is being chosen that year for the outcomes bonus. So it's very important that, as owners of the company, that we give back and do our part to the community, and donate a part of our profits. It is extremely important to be able to provide services through, we'll say through a nonprofit, to make sure that the community is getting the things that they need. So with any kind of organization, there's always a disclaimer. If you choose to do this kind of a business with us, because there's so many different things that you can do, we want you to succeed. With this being said, you understand that we are not responsible for any lost revenue, insurance, licenses, lawyers' fees, internet fees, taxes, digital device access, service, like internet service goes down or something like that, and office expenses that are not covered in our business agreement. We will help you to get started here, and we want you to know that we will answer all your questions and help you feel like this is a good decision for yourself. So the reporting, this is my baby. I love this. So the Resulti Enhanced Anonymous Reporting System, otherwise known as REARS. It is trademarked by Nurses Against Violence Unite, and I put little pictures in there to change the companies and organizations that we report to. But you kind of can figure that they're pretty big names that we would be reporting to. So we'll just use this as an example. Somebody comes through with Nurses Against Violence Unite, needs to file a report, anonymous claim against an employer or something. It's encrypted, and then it's fanned out to the agency, as well as also to if there's a healthcare, like we're supposed to get wheelchairs in and we never got the wheelchairs, and we want to know where that funding went, and we can make that report, and that could be dispersed to where that needs to go. So what the beautiful thing about this is that it holds everybody accountable. So we would gather your information, we would disseminate it, and then we would follow up. If the person's like, I can't find, there was a report, what? No problem. So we come back after we've already had it dispersed out to the company and they can't find it. We'll make sure that they get it again and again and again until that claim is resolved. So I love this. This is a beautiful thing. So questions and answers. These are very important. So are you an employee? No, you will be an independent contractor, and we will help you to build your brand, as well as also with, with all the other things that we're coming out with. It is like absolutely amazing. We're having, it is going to be a wonderful thing when you decide to come on with us. So nurse practitioners, if I'm a nurse practitioner and need a collaborator, how can I start? Well, if you need a collaborator, we might have a collaborator. If you don't have a collaborator, if you do have a collaborator, let them know that we would like to talk to them, because we also have a bonus program for them as well. Also would like to let you know that we are running a bonus program for anybody that brings in a nurse practitioner with them, or even a registered nurse or a physician. They will get a certain amount of money that's going to be dispersed after the first year that you guys are with us. So it's really exciting. And but definitely, if you're a nurse practitioner and you need a collaborator, you both can come. Same thing goes with so then if you have a collaborator, we have a program for them, a bonus program. So, and you can start pretty much right away. If you don't need a collaborator, that's even better. So if you're a physician, so how much will I get paid if I'm a doctor? Well, we have the bonus program, as well as also we have the outcomes bonus, as well as also we have the 60%. So who gets paid 60%? Everybody gets paid 60%. It just depending on how much the reimbursement comes back, it varies, right? So 60% of all revenue that comes in to the for that provider. So here's where I get a little bit of mushy, and I get a little bit like, I get a little bit, emotional, but it's okay. So my biggest thing is, are you ready to take back healthcare? Because it's a hot mess right now. And what the great thing about this program is that it's going to show you and give you that lifestyle, give you the time freedom to be able to take care of your patients, and you don't have anybody breathing down your neck, and you can go on vacation without having any kind of repercussions. It's a beautiful thing. So what I really would like to know is, what is your why? Why are you here? Why are you looking at this opportunity? Why are we doing the things that we do? Why are we healthcare providers? Why are we nurses? Why do we do what we do? Well, I could tell you a little bit about myself. So I am a nursing professor, as well as also I have the Nurses Against Violence Unite, where when I was working on my doctoral project, it really hurt to find out all the holes that were in healthcare, as well as all the injustices that were happening in it to nurses, as well as also doctors and nurses aides. It's really, it really hurts to see that we were left out there to fend for ourselves. My why is to take back healthcare, as well as also to just change it, just absolutely change it. There should be no reason why things are happening the way that they are in healthcare to us. My other why is my children. My children are my life, like they are my heart, and that's my why. And standing up for the things that are important, and that is to take care of our students, to take care of each other. That is my why. We are one of the best professions, nurses, nursing, as you know, and all healthcare workers. We are a different kind of breed, and it is very important that we understand and we take back the things that we deserve. And even if we never had it in the first place, we create it for ourselves. So the beautiful thing about Together Wellness is that we are together, we are family, and we're the model for what's to come in healthcare. So indecision is the thief of opportunity. It is also the thief of happiness. And I mean that wholeheartedly. It is very important that we all have that reason to smile during the day. We all need that reason to help our why, right? So this is the right choice. You might not see it now. If you do see it, thank you. So basically, you can make unlimited income potential. You have work-life balance, as well as streamlined technology to help you so you don't have a lot of hiccups or none at all when you're trying to do your business, as well as time flexibility to see patients. And you can use your own model. No to low cost startup, and you have a business in a box, and you have people to help you. So my little blip. So with that being said, I thank you very much for your time, and I look forward to working with each and every one of you. If you have any further questions, please write them down and feel free to get back with me. And I will have my information on the website. We also have a website, and that is doc, DOC, like nurse practitioner, doc nurse practitioner, docnp.com. That is our website. You can get our contact information from there, as well as also you can email me personally at Dr. Sandy, DRSANDY at teledocnp.com. And I look forward to working with every single one of you. And if you have questions, write them down and make sure I get them, and follow up with me. And thank you so much. You have a great day.